Hi, I'm Dr. Erin Lucie.
And I'm Micah Lucie.
This is our 4th episode of our podcast. Today we're going to talk about our going beyond Botox and really what does that look like? I've always said Botox is a Band-Aid and it doesn't really fix the things that we really want it to fix as far as like being functional and intentional about what we're treating. When we think about Botox, we typically think, oh, that's for fine lines and wrinkles. There are a lot of other medical procedures or medical diagnoses that we use to treat with Botox cosmetic. But really, when we think of wrinkles and fine lines, Botox is kind of the first thing that comes up. But we want to make sure that we're going a step deeper and really fixing and correcting the problem that's happening, which would be decreasing collagen, a decrease in elastin, inflammaging, aging in general, and stress.
Yeah, because really the goal is, obviously treatments are great, but you want to stimulate the body's own production of things to help you look healthier. And skin is so tied to that, so tied to the quality of your health, that it's important to get that back in line. And, treatments are great. Probably going to need them as you age, different things. We get wrinkles, can't avoid some of that, but loss of collagen, different things in that kind of area can be corrected without having to go for intensive treatments.
Mm-hmm. And one of the questions that we get almost every single day is, can I take this collagen supplement or should I take collagen supplements? And supplements are fantastic, but we're going to dig a little bit deeper into collagen and kind of how it really works within the skin and within the gut lining and how it functions. And one of the things I think of when we talk about collagen for the skin, because collagen is like your structure or your foundation. If you can imagine like these, like the scaffolding of your skin, and then elastin is like the slinky. It's what gives it its stretch. So you want to be able to like push and pull on your skin and it bounces back. That's going to be your collagen and your elastin. And that's what we're making tighter and stronger. If you have a slinky that's all stretched out, we want to make that tighter. When we do skin tightening treatments like laser and resurfacing, we're making that collagen grow, and then we're making the skin be tighter so it grows and heals and repairs itself. So when we do the treatments, basically we're going to burn the skin or injure the skin in some way when we use a laser or we use a Diamond Glow, a microderm, something. It's going to help to break that skin down, and then your body is forced to grow and heal and repair it. And now we have better supplements and we have better treatments that we can accelerate that growing process. Now, I always think it's best to start with products at home that are going to help increase your collagen, because we're putting those products on every single day. So we start with them like retinol, which is vitamin A. You want to use that treatment that serum every single day if you can, basically as much as you can tolerate of your retinol. And we'll talk a lot about retinol, but vitamin C helps to increase collagen, and you can use that topically every day. And then there's peptides and growth factors that will help to regrow and repair that collagen and that elastin that you have. So we can absolutely put these on topically because it's going to be better. It's kind of like brushing your teeth every day, twice a day. You want to do those products topically, but you can also take them internally for full body collagen.
Yeah. And really, the key here to a lot of this, you're talking about vitamin A, vitamin C. One of the keys is really understanding the health of the gut. If you're not breaking down foods properly, if you're not absorbing nutrients properly into the bloodstream, into the body, then it really defeats the purpose of even doing this. So for example, is a kind of a term that used to be a buzzword, but it's more common now, which is called leaky gut. And leaky gut basically means you have a 1 cell thick layer wall in your intestine, specifically like small intestine, large intestine, but its job is to essentially block things from getting into the bloodstream until they're ready. So for example, if you're eating an apple, and you talk about the vitamin C, if it breaks down to that right nutrient size, the body's like, okay, this is why I know I can use this now. That will actually pass through those cells and get into the bloodstream. But what happens is the more stress, the more inflammation, the more damage we have internally damages that wall. And if you picture like a kind of like a castle, or like the Great Wall of China, for example, like if you were to break part of that wall open, you could sneak through. That's basically what's happening, is things will get to the bloodstream that shouldn't. So when your digestion is compromised, collagen, vitamin C, vitamin A, all these important nutrients, proteins, they're not getting into the body, they're not getting absorbed properly, and your skin gets affected.
Mm-hmm. Now, as far as like taking a collagen supplement, the way I think of it is it's like if I were, let's say I wanted to like work out and get ab muscles, I couldn't just take a piece of steak and rub it on my stomach.
I tried it. It didn't work.
And have abs. Like, unfortunately, it doesn't work that way. And collagen is kind of the same. So we can't just take collagen and rub it on our face and hope that our skin will create collagen. Like, they don't work that way. Collagen doesn't make collagen. There have been tons and tons and tons of research on collagen. And we know that if you take collagen, your collagen can improve a little bit, but they don't really know like why that's happening or how that's happening, because scientifically it doesn't make sense. Like we don't have, like you can't just like put collagen on collagen and get more collagen. It doesn't work that way. Somebody explained it to me. It was like, if you have a glass window and another glass window, like you can't have a glass window make another glass window, but you could break that glass down and then melt that glass and then make a new window entirely. But you wouldn't be able to have the two planes go together unless it was broken down. And that's really kind of where peptides come in. And peptides are a small chain of amino acids, which is what create protein. And peptides are messengers, like text messaging. Peptides are messengers that send signals from one cell to another to tell them exactly what they want to do. One of the peptides that we used to use a lot are like hormones with growth hormone, or HGH. But HGH would actually like regrow everything. So we would use it to regrow muscles and make you look younger. But then too much HGH and your ears would start to get bigger and your nose would start to get bigger and your voice would get deeper. Kind of you had all these side effects. But now with better technology and peptides, we can use the peptides to help us grow specific things like muscle and skin and tendons and collagen and target those things. We just have better technology with peptides that we can use for the skin and your body now.
Can I give you one tip on growth hormone?
Yes.
So obviously your body knows how to do its job, right? So growth hormone, the biggest surge of that is actually between 10 p.m. and 2 a.m. So for those of you that are staying up late, midnight, you're missing a massive window of growth hormone that your body's producing naturally to help rebuild you. So just a pro tip.
And that's why it's called beauty sleep.
There you go.
Yeah, you really only grow and heal and repair yourself while you're sleeping. So you have to actually be sleeping. And it is healthier to sleep in a dark room. Even if you have lights on, like an ambient light or, like your alarm clock, your body can still recognize that light and sense it and not heal as good as it should. And so you should sleep in an entirely, totally dark room, cooler temperature, which helps your metabolism or your metabolic rate to start that healing process.
Yeah, and actually keep it quiet too. I've heard of people listening to podcasts while they sleep, which is wild to me. It's like, I want no sound at all.
Yeah.
You're talking about proteins, amino acids, things like that, as far as the peptides. But amino acids are really the building blocks of everything. Our muscles, our cells, our neurons, everything we are amino acids. So they're so important. And one of the biggest markers that I can actually test for is something called indican. Indican is a byproduct of poor protein digestion. It's not something we want to see. So the higher that indican comes back for a client, the higher that they are having digestive problems. They're not breaking down their proteins. And you think about all the things that are being affected down the line from that lack of amino acid production and absorption.
Right. So even if they are taking collagen supplements or protein supplements, your body is not absorbing them if you have that high indican. Is that what you're saying?
Absolutely. Yeah. If you have high indican, protein's not happening. So you could take all the protein you want, but it's not going to make a difference for sure.
And I've seen this in patients like my GLP-1 patients, because those GLPs, like we've talked about before, is they break down the muscle mass. So they're helping, you want to make sure that you're eating like 90 grams of protein or 120, 130 grams of protein. You're replacing that protein so that you're not losing that muscle mass. But I still see it happen in some patients that they're eating a lot of protein, but their body is just not absorbing it and they can't utilize it. And that's a great option to use that test.
Yeah. And really, so as far as protein, consumption goes, kind of the rule of thumb is 1 gram of protein per pound of body weight. It really depends on how active you are. If you're like a bodybuilder, then obviously that number is going to be higher. If you're someone that's been more sedentary, you haven't done as much movement or exercise in a long time, then you want to maybe put that a little bit lower, like 0.7, 0.8 grams per pound of body weight. But really trying to stay within that level will make a huge difference.
Mm-hmm. So having your protein up that high is going to help increase your collagen, right? And we use the collagen for your skin. We use it for your joints, your tendons, your hair, your nails. You see a lot of supplements out there on the market for hair, skin, and nails that have collagen in them. We just want to make sure that you're using a brand that is appropriate. But I always tell patients, you don't have to rely on a supplement necessarily, as long as we know that you're absorbing it. I think the best source is really just making your own bone broth, like going to the butcher and getting bones there and like cooking down your own broth, because that is pure collagen bone broth.
Yeah. And another thing that people kind of miss on top of the protein is really the healthy fats as well. I think fats kind of gotten this bad rep, but fats are so important. Our hormones, for example, cholesterol, B vitamins, they're made from fat. Our mitochondria use fat to essentially travel and help build energy for us. So incorporating those healthy fats like avocados, things like that would be great. And when it comes to cooking oils, that's one thing I always like to tell people is stay away from like your canola, soy, corn oil, and replace it with things like avocado and olive oil as far as for cooking and things like that. Way healthier. You won't have that oxidation, that inflammation from those oils, and you'll get a lot of benefits from it.
Yeah, we actually don't have any of those oils in our house.
Not anymore.
I was making a gluten-free pumpkin bread recipe, and all of the cakes and muffins, they all call for a vegetable oil in there, and you can replace it with applesauce. I use pumpkin puree. And so there's lots of options to help you get those healthy fats in there. Even our like all of our skin cells have what we call like a lipid bilayer and that's what like really kind of protects us from everything. And our chemical peel line, our main chemical peel line that we use right now, they actually added peptides to their chemical peel because the peptides help lower the pH and they're lipid soluble. So they are attracted to that skin cell and they're able to go in a little bit deeper. So you have to have those healthy fats and products that have oils in them. I see with acne patients, they put products that are oil free, but actually it's not healthy to have totally oil free products in your skincare line because your skin is made of oils and likes are attracted to likes. So if you want your skin to actually use the products, there has to be some form of a healthy oil, healthy fat in it to absorb and react properly.
Yeah. And one last easy kind of thing to add into your life is creatine. Creatine is a super cheap solution to help build lean muscle, help your collagen production, and surprisingly enough, actually helps your brain as well. They've been using creatine kind of like in the more senior population and seeing huge differences in their cognition and the way they think and focus. So that's something you can get almost anywhere. I mean, jump on Amazon, you can get a cheap version of that.
Don't do that though.
Yeah, I was about to say, actually, what they found out with Amazon is that 70% of the supplements offered on Amazon are not accurate. Some are mislabeled, some are a different product put in the wrong label. So strike my Amazon wording.
Strike your Amazon. What he means to say is that it is readily available.
Yes.
There's lots of different brands, lots of different companies. It is something that is not hard to find. But again, you want to make sure there is, if you look at like bodybuilders, it's kind of like in the bodybuilding world a lot, or you think of with men, but there's actually a lot of research for women now with cognition and preventing dementia and Alzheimer's and even maintaining muscle mass with women. But it's like 2.5 milligrams.
2.5 to 5. Yeah.
Yeah. Well, for women, it's going to be lower. Typically, it's going to be lower. Yeah. 2.5. You can do a starting dose of 5
grams.
When you first start, we kind of do like a loading dose and then you go down to the 2.5. But the creatine really is going to help with keeping the skin strong from like a skin perspective. From a health perspective, we're looking at brain health and muscles. And then with skin health, obviously, the skin is an organ and it is that connective tissue and your collagen and your elastin, and that collagen, because it is protein, that's where the creatine is going to come in. So the main two supplements I put patients on is going to be collagen, whether it's through a supplement or bone broth, and then also creatine. All of my skin tightening patients, I like to be on creatine to make sure that their treatments are really working and lasting.
Yeah. And I would say even just one more, not to put a million out there, but
I like a lot of supplements.
Omega-3s are great. Obviously getting fish and seafood is great to get omega-3s, but omega-3s are huge in fighting inflammation, especially if you deal with things like joint pain, that kind of stuff. Omega-3s will help with that tremendously. So
omega-3s also help with rosacea because they are anti-inflammatory, and rosacea is an inflammatory disease. And then also there is a fourth or third, like there's 4 different types of rosacea. And the third one is when rosacea goes into your eyes, and omega-3s can really help decrease the inflammation in your eye and dry eye specifically.
For sure. And then as far as your gut, we talked about the gut being super important for that, nutrient absorption, all those things. You really want to find one that it's a way to support your gut. And what I recommend is a prebiotic and probiotic, but they're actually combined together. So what's really cool about that is that when you take that supplement, the prebiotic, as it's broken down by your stomach acid, actually feeds the probiotic inside. So you're not losing a lot of this bacteria as it gets into your body to be used. There's a product called Seed that I love that I recommend to almost every single client, depending on where they are in their journey. But Seed is one of the best ones out there that I can recommend all day long.
Mm-hmm. Another peptide I really like for the skin is copper peptide. Copper peptides they've used for a long time in skincare, topically. So you have these peptides that help to increase collagen, and then now they have patches that you can put on the skin. You have copper bracelets, and the way that it works is 1, it's helping to increase collagen, and 2, it's helping to decrease inflammation. Inflammation creates more aging and wrinkles and fine lines and joint pain and all that stuff. So a copper peptide is an excellent way to decrease inflammation in the skin and body.
Yeah, like you mentioned, like these peptides are kind of helping the messages get across more clearly. So not getting that jarbled text message is going to be great for your body.
Yeah. So as far as like Botox and in that consultation of, do I need, what do I do next whenever I'm starting to see fine lines and wrinkles? I always go to supplements first. We like to do testing, and then really looking at the other treatment options. But if our gut isn't fixed, then we can't progress to the other treatments. But treatment options for fine lines and wrinkles would be like microneedling, resurfacing, and PDRN. I would love to have a whole podcast on that, so that might come up next. But PDRN and these treatments are basically increasing the collagen and the elastin so that your skin is going to be stretchier and bounce back. And the way I kind of described it to a patient is if you have a piece of paper and you're folding it, when we're younger, that paper is just going to like fold back to normal. But when we're older and you fold that piece of paper, it's going to create a line because that collagen is down. And so we want to make sure that we're increasing that collagen and making it to where your skin is thick and healthy, regardless of whether or not you're using Botox.
Yeah. And with any treatment, even if it's just, a surgery, nothing to do with aesthetics, like the goal is to reduce as much inflammation before and after that procedure so you have the best results possible. In an ideal world, if somebody were to come in for Botox, I would love to work with them for 30 days before they do that, just to get some things going as far as reducing inflammation, getting them stronger. But it's so important to do that.
That's going to be the theme of every single podcast is how to reduce inflammation.
Yeah. Inflammaging. Yeah.
Right. It's all tied together. Well, I think that's all we have for episode 4.
Yeah. Thanks. Stay tuned for the next.
We have lots of things coming. We are definitely going to talk about PDRN and all the aesthetic treatments one by one. We'll have some of our girls that work in the office. I talked about we work as a team together to talk about all the patients. So we'll start to have some more guests on here soon. I'm Dr. Erin Lucie.
And I'm Micah Lucie.
We'll see you next time.